Hi everyone. I thought I'd try something a little bit different today and outline some of the discussion that's occurred at the board meeting a couple of days ago. I'm really trying just to keep you up with what discussions are occurring, what are some of the large strategic issues, what's on the mind of the board and the executive team. So we had, as usual, a relatively long board meeting. These normally last for about 6 hours, and we had some cancellations of flights and things, so a number of board members had to teleconference in from various places because we do have 2 board members from Auckland. Probably the biggest issue that was discussed at the board, and there was a paper on our challenges with acute demand across the organisation, particularly the impact on emergency department, the growth in medical admissions, some of the strategies and some of the investment that we've put into various areas, because you have to remember every year we're growing, and these are mainly clinical roles, by between 60 to 100 staff, and yet we always feel like we're playing catch up. The board approved at the end of last year an increase in our deficit and a further $3 million or $3.2 million being invested in a number of services to try and address this. But we've been absolutely slammed over the Christmas period and basically December, January and February. There was a table showing the emergency department presentations and pretty much 1,000 extra presentations during that period based on last year, and that growth is every year, and so that this year represented about 8-9%. Some years it's more like 3%. Across the whole country there's a significant concern about acute demand, and even areas that aren't growing as rapidly as us we're experiencing, particularly over the Christmas period, significant growth. So we talked about some of the strategies and what else we can do. We've been working with Scott Cameron and a number of our senior clinicians to try and look at developing some further initiatives. One of the things that really concerns me is Code Red has become the new normal within emergency department and the hospital, and so sometimes our response to that is not perhaps as urgent as it could be, and actually sometimes we're really hampered as to what else we can do. But clearly patient flow is a significant issue, because what is really hampering the emergency department's ability to process patients and get them into the hospital is that we've got bed block, and that's despite now opening another 12 beds in Ward 12 and basically having every physical bed we have open. Obviously at times staff illness and sometimes vacancies are compromising how we can care for patients as well, so that was a significant discussion, and I want to talk about that a little bit more. But other things are that we have a set of standard operating procedures, and those aren't always being adhered to, and they can at times make a big difference if every department is aware of not only their own departments and wards but also the impact on emergency department. We've got problems with access to community services and being able to discharge patients urgently. We often have to wait for patients who are waiting to be seen, cardiac procedures, etc. in Auckland. So there's a number of things, rehab at times, that can also impact on that flow of patients. But we have seen an increase in length of stay. Sometimes that's because of the complexity of patients, but it may also be that this bed block is really having a big impact. So that's really our biggest issue within the organisation at the moment, is how to manage this acute pressure and acute demand. Acute surgery is a major issue, and access to acute surgery, and we're trying to progress a number of business cases to get more theatres. We're also looking at how we can run theatres for longer and have an extra session in those theatres so that we can continue to provide acute care for our surgical patients that need it. one of the worst things is patients who are starved, having to be cancelled day after day for surgery. Obviously also cancelling electives is really inconvenient for patients. So these things we're trying to address, and we're working with all of you to try and address those. An interesting discussion was had, and it involved one of our union organisers as well, who was attending, and of course every public member is welcome to attend our board meetings. Sometimes we have media, sometimes members of the public. So we were discussing the issue around vacancies, and I really want to assure you right now that we don't hold vacancies at all in the organisation. Haven't done for years. It's harmful, particularly for clinical roles. There's no point. It costs us money, costs us and compromises care. And so when I receive the vacancies, and if I could show you the folder that I usually have each week, they're in and through my desk and off my desk within a few hours. So they don't wait, they don't need to go through the CFO, and so it is your teams who present those vacancies. One of the things we did discuss though was how we can even further speed up recruitment, and that's the real challenge, because we often only get 4 weeks notice of someone leaving the organisation, and then of course it takes longer than that to recruit. On the subject of recruitment, we've agreed that we will recruit and over-recruit all of our North Tech nurses, and we'll look at other areas where we need to, if necessary, over-recruit, because the issue of vacancies and not having enough staff to care for our patients really does worry us. We also had a good discussion on aged residential care and presentations through to ED and admissions from aged residential care, and how we could improve the care of patients in the aged residential care facilities. That's our rest homes and private hospitals, and the role of GPs, and also our own role with some of our nurses who are working in those. And there's been some good pilots where that's made a big difference to the number of patients we're seeing coming into the hospital from aged residential care. We've also talked about our health services plan. The last health services plan was completed in 2017, and we've now embarked on a planning process for the next health services plan. All of you can be involved in that, and we want it to be your plan, and we're not going to make the decisions on what priorities we have without you. We're also going to make sure it's a plan that can be changed and enables us over the next 5 years, rather than something that is very rigid, because the world changes, technology changes, expectations change, governments change, priorities change, and so we really need to make sure that we have a plan that is fit for purpose, but also able to be changed as it needs to. You'll see around the place some little graphics of some of the achievements over the last 5 years. We had some headline targets. Some of those haven't been achieved, but there are a lot of interesting achievements, and it does outline some of the projects and the work that's been done over that period. So if you are seeing these on some of your snapper frames or somewhere around the organisation, have a little look. Some interesting things which go against the national trend is our average age of our staff has decreased, and so it's gone from 47 years to 46. Not a big change, but at least it's heading in the right direction, and that's encouraging. Also, the percentage of Maori staff has increased. So there are a number of areas where I think some of our strategies are showing really good progress. We've got our neighbourhood healthcare homes strategy, patient and whānau-centred care, urgent healthcare, and obviously with our acute demand, that's a major focus at the moment, and a number of other strategies which I think are making a big difference. Some really great stuff happening in child and youth, but still significant problems. And obviously the whole of Northland is challenged by being so rural, having the second oldest population in the country at 19%, a high Maori population at 34%, and also one of the poorest regions. So we have that perfect storm of I guess, demographic change, which really does challenge the organisation. And I've got to say, the growth in Northland, which is now only second to Auckland City itself, is phenomenal at the moment, and it's running at about 2.4%. So that also puts significant pressure. Last year we had another 4,000 people appearing in Northland, and of course they get sick and they need healthcare services. So our arguments around funding and addressing the issues around the funding cap that we've had and the 30 million basically that we haven't received over the last 3 years are really strong, and those are still ongoing, and those discussions are happening all the time. So a few of the other things that we cover off on a regular basis is all of our new initiatives, and a couple of those that I'd just like to highlight: the Neighbourhood Healthcare Homes project, which is looking at reconfiguring and redesigning how care is provided in the community, in general practice particularly, but also with other services in the community, and so a lot of work around health and social care as well, and progress on that is strong, and we've now got about half of our population covered by these neighbourhood healthcare home practices, and that's going to increase further this coming year, and we hope to have certainly 2/3, 3/4 of our population covered by the end of next year, next financial year. So just looking through the list of other things that we're covering off at the moment and discussing, there's quite a novel project around collaboration with primary care and our Māori providers and our iwi providers and the DHB, and so all of those organisations, our 2 PHOs as well, are working towards a much better, more joined up system and improving care in the community, which can only improve and reduce the demand for us that we're seeing within the hospital, and so I think that's a really good thing. Our health target results are always discussed, and I won't go into those today. They sit somewhere in the middle of the table, apart from 1 or 2 where we aren't doing as well, and 1 in particular that we do very well in. So there's a bit of a mixed bag, and it's important to keep a focus on those without losing sight of other important issues as well. Good news is that we've commenced a new service, what is called ERCP. It stands for endoscopic retrograde cholangiopancreatography, and that means being able to put a gastroscope in through the stomach and look up into the bile ducts, common bile duct, etc., remove stones. And quite a number of patients each year require that procedure and have travelled to Auckland, and now with our new gastroenterologist and one of our surgeons, and soon to be our second gastroenterologist, we're able to provide that service up here, which is great news. We spend $79 million on inter-district flow, and so not only does it provide a service locally, which is the main driver, but it also means there'll be a reduction in expense around that as well, so that's a good thing. Our methamphetamine pilot, Te Ara Oranga, is going great guns, and so we have put forward a proposal to the Minister and also the Minister of Police around ongoing funding from the Proceeds of Crime Act, and so that program is funded outside of our population-based funding formula, but is a very, very innovative project, a collaborative project, and very engaged with the community, so quite an exciting new initiative for what is absolute scourge for Northland. We've also got our new patient at risk team, and so we discussed a little bit about that and the fact that now that service is 24 hours a day, and it's an ICU outreach service if you like, but it means that all of our sickest patients will be helped by this service, and wherever you are in the hospital in Whangarei, you'll be able to access patients will be able to access the service if they need it. So that's great, because we can't have every patient going into ICU, unfortunately, and that wouldn't be appropriate, but often patients are deteriorating, getting sicker on the wards, and need additional expertise and assistance. So it's a good patient safety initiative. I want to acknowledge our other hospitals. Obviously, we're not just a Whangarei hospital, and we're not just a hospital, we are an organisation, and we fund all of the health services for Northland, but also provide a lot of community services, and they're all doing great work and very innovative in their care and their models of care. One of the things I do want to acknowledge is the Bay of Islands staff, and particularly those who are at the moment having to travel significant distances because of the slip on Lemons Hill and the blockage there, and they are going way outside of what I would have expected of them. They're fantastic in that they are still getting to work on time, being innovative around visiting patients, etc. It's a big ask, and I'm really hopeful that that will be resolved as soon as possible, so thank you all for that. Some of the other things that were discussed are around our patient experience survey, and we do look at what our patients are saying to us and really helps inform us as to the sorts of care we're providing and looking at any issues there. Also the health and safety report, and we were noted an increase in accidents in the last quarter, which was disappointing, although none of them were serious, and a lot are around slips and falls or manual handling issues, and glad to say not many of those were around violence from patients or staff to each other, so that's a positive. Just a quick update on all of our planned capital works, which we discussed. So we've got a business case going into the Capital Investment Committee next month, and we've got one in with the Capital Investment Committee already around the Bay of Highlands Hospital extension, but we've also got a business case for a number of interim projects which will help take some of the pressure off the hospital in Whangarei, and so those include a new endoscopy suite, 2 new theatres and some associated services around those theatres, as well as a community mental health facility and an outpatients facility and a cardiac cath lab, and so those total about $35 million, and we're hoping for a quick response from the Capital Investment Committee. We don't have that cash, we pretty much are running on no cash or very low cash, and so that funding will need to come from government, and so we have put in a really complex business case around that as required through the Better Business Case process, and we're hopeful that we will get a rapid answer to that. As well as that, we're progressing with the much larger Whangarei Hospital rebuild, and unfortunately that business case process takes a significant amount of time, and we're trying to speed that as much as possible, but working towards what are the options, and we've designed a number of options which include both Greenfield site in the car park by Child Health Clinic, the option of building into the public car park, which used to be the tennis court by the nursing home, or moving across and taking out some of the hill in between emergency department and mental health, and so we're looking at all of those options very closely at the moment, and that business case should be submitted to the Capital Investment Committee by June. So there's still ongoing business cases required, but we've already had support for the first business case around that, so they're very supportive of the project. Just need to work out how we can get the $600 to $800 million that will cost. So a lot of work going on around our capital works. So I guess that's pretty much it from me today. I'm hopeful that some of that will be useful for you and of interest, and keeps you informed. I'm going to try and do this every month, and it's probably easier for you than wading through a whole lot of papers and board papers, which you're actually welcome to do if you're interested. I hope this is a much more efficient way of doing that, and it also describes what decisions have been made, if any, around the various meetings and various issues that come up during the board meeting. Thank you.